Hi there everybody and welcome. So if you're seeing this video and you have a child, then I want you to spend the next couple of minutes just listening into the couple of things that I have to say when it comes to training your children and the special considerations that need to be applied to your child's training when it comes to resistance, cardiovascular / endurance training. So you have decided as a parent you really want your child to start getting involved in physical activity and to start participating in sports, but you just don't know what sport is going to be right for your child because you want to make sure that he grows to the optimal health and grows physiologically and biomechanically is able to operate properly. So here are a couple of special considerations that you really need to apply, or that the trainer or the coach needs to apply when training children. We all know that children are currently in the developmental stage of life. So that means their bones are growing, their muscles are maturing, they're gaining kinesthetic ability, their ability to actually complete their fine motor skills is really being developed during this period. But studies have suggested that children have a higher incidence rate in overuse injury and damage to joints where excessive exercise occurs. And if the child encounters something like acute trauma or excessive jarring motions to their joints, there is going to be some sort of damage during this stage. Now, the reason for this is because children have something called epiphyseal growth plates, and these growth plates are responsible for longitudinal growth. So basically, they're responsible for growing the bones. And if we constantly apply pressure and jarring motion to these bones, this cartilage or this hyaline cartilage in between the joints tends to get a bit damaged and reduces the ability to grow as much as children should be growing. So this affects his or her development. Around ages 12 to 16, for girls and 14 to 19 for boys, that is where we tend to see a closure or a complete calcification of our bones. So that is where you really want to start applying a bit more of intensive activity when it comes to training your child. The one consideration that I think a lot of us tend to forget about is that the focus on participation in children is supposed to be solely on motor skill development rather than the amount of resistance a child can lift. You are not looking to make an Arnold Schwarzenegger child. What we are looking for is we are looking to reduce the chance of injury and to improve a child's kinesthetic ability, muscle memory control, and proprioceptive skills to ensure a wholesome fitness development. So we are looking at main areas in which we really need to improve everything. It is not solely about giving your child resistance training, making him or her run a marathon in under 2 hours. We all know that is achievable, but for this developmental stage, we really need to focus on the critical aspects of ensuring the child's development, and 1, ensuring participation, and 2, developing their motor skills, and 3, the social skill development is ensured during this process. The epiphyseal growth plates are responsible for longitudinal bone growth, and this happens by a mechanism called endochondral ossification. Once we have stopped growing, these bones are replaced by an epiphyseal line, and this replacement is known as an epiphyseal closure or growth plate fusion. Most importantly, in certain environmental conditions that are unsuitable, children show less heat dissipation than adults because of a lower sweat rate and evaporative heat loss. This results in greater heat production per kilogram of body weight. A consideration that must be recognized is that children acclimatize to heat slower than adults, and in cold environments exactly the same principle applies. The reason why is because the high surface area to body mass ratio of children can accelerate heat loss. This increases their risks of something we refer to as hyperthermia. Suitable environmental conditions with appropriate clothing, hydration, should be an important consideration when programming for a child which is training in unsuitable environmental conditions. So now that we've considered some of the special considerations when training children, I think let's start to look at the training equipment and the environmental influences and how they should be varied appropriate to the size, strength, and the degree of maturity of your child. Training should be a comprehensive program to increase motor skill development, promote social skills, and promote whole fitness development. The objective is to ensure a healthy development of a child and not to overspecialize the child, which will reduce his or her ability to actually compete or participate within the activities because they've learned to hate it instead of love it. So now that we've reviewed the special considerations, understood the environmental factors which are applied when training children and youth, let's start to look at the specificity of what it means when we start doing training. So we're going to cover resistance training, how a child should be doing resistance training, what should be done and what shouldn't be done. We always refer to something called the ACSM guidelines, which are international guidelines that have been set for trainers, for physiotherapists, for exercise specialists to adhere to ensure the promotion and development of children. So as I said, we refer to those ACSM guidelines, and the specific guidelines as per the ACSM on exercise testing and prescription for children recommends that the intermittent nature of resistance training is compatible with the child's natural physical patterns and abilities. So you do not want to walk into the gym and seeing a trainer busy doing squat cleans with your child. You are supposed to be focusing on kinesthetic movements, agility, balance, coordinatory based skills. We're not looking to develop a CrossFit athlete at age 7 years. That is definitely out of the question. But most importantly, are we developing that child in the way in which he or she needs to be developed? This doesn't mean that we don't do resistance training. What this means is that there are special considerations which need to be applied to resistance training when working with a child. Resistance training is okay for a child to do, but avoiding overly intensive 1-rep max training is really important. The reason why you do not want to be doing this with a child is because, like we stated in our special considerations, our objective is to reduce the risk of bone, cartilage, ligament, and growth plate damage during this developmental period. So there are certain principles that need to be applied. We don't just apply 1-rep max training. What we do is we do gradual progression of resistance. This is important to avoid excessively demanding activities which limit their abilities or are limited by their abilities. And if you continue to train a child doing very intensive activities and things that he or she is not able to attain, this is going to result in regression and discourage the subject from being able to participate in activity. And as we said before, one of the main considerations is participation. Children are children. They like to have fun. They like to play around. And during activities with physical resistance, children should be performing around 8 to 15 repetitions per exercise, and the resistance should only be increased when the child's motor control and proprioceptive abilities have been improved, enabling the resistance to be increased, and then it will challenge he or she once again, so that they're having fun, they're seeing that they're getting better, and that's the way in which it should be done. Those ACSM guidelines, they recommend that 15 to 20 minutes of vigorous intensive exercise 3 days per week is recommended at maximum, because children are anatomically, physiologically, and psychologically immature. Special precautions must be applied on a cardiovascular level. The reason why is because their organs are smaller. We're talking about their heart, liver, lungs, pancreas, kidneys, etc. Therefore, the capacity as a reservoir for blood is smaller, and thus resulting in children having a lower stroke volume, which results in an increased heart rate when they are at resting. So this means that sometimes cardiovascular activity and endurance-based activity is really not going to be suited to your child. Sustained cardiorespiratory endurance activities such as distance running, cycling, swimming are not typical of the normal patterns of children. And in young children, emphasis should be directed at play and intermittent bouts of physical activity, improving their physical skills and cognitive abilities. Due to the proportion size of children, they have a faster recovery heart rate post-exercise in comparison to adults, and a greater response to static exercise than adults, which is advised. One thing that we must also recognize though is that muscle glycogen levels at rest in children exhibits higher lipids, glycerol and fatty free acids as a main primary energy source, resulting in children to be better at prolonged exercise than adults. However, children are at a higher risk of hypoglycemia as their hormonal levels are currently still developing. In the contrary to that though, children do have a reduced anaerobic capacity in comparison to adults and are not able to tolerate high volumes of intensive training. This reduces aerobic capacity due to the hemoglobin and red blood cell count being lower in children than in adults, which requires them to have longer rest periods during activities. Children also have immature motor development, a higher sense of gravity, and differences in body composition, which affects their balance, coordination, proprioceptive skills. However, this is not to say that cardiovascular activity should not be done in children. Cardiovascular activity is advised. However, long-term endurance-based activity is not advised in children. What is recommended that at least maybe 3 activities of 5 minutes for 15 minutes is going to be enough for your child to participate in physical activity and to promote his or her development. Most importantly, it is to recognize that children are not endurance athletes and that the aerobic and anaerobic systems have to be built up in order for them to achieve the level in which you are wanting them to perform at.